Good afternoon, everyone, and welcome to our July Food Security Community Call. I'm Anne Marie Hart Bookbinder, Food Security Programs Manager at the Food Council. We still have some folks coming in from the wait room, so I'm gonna give us another minute or two to get started, but I hope everybody had a nice holiday and a nice weekend and staying as cool as possible under current weather conditions. But I'm glad that so many of you were able to join us on today's call, especially being the summer. We know it's a time where getting a little bit of relaxation in at all. So thank you all for joining us today. Give it one more minute. And since let's see, our first presenters were going to be from MCPS, but if they have not joined us yet, we will get started with Allison from our SNAP team and just flip things a little bit in that part. I will share the agenda in the chat in just a moment. But Liz or Nick, if you are here and would like to get us started, we can do that. If not, we will switch over to Allison about Sunbucks.
Hey, Emery, and we are here. I know I'm here. I think Nick is on. There's so many names I can't see. But afternoon, everyone. Happy July. Echoing Emery's comments, staying cool out there, especially if you're visiting a summer meal site. So, MCPS is hosting over 100 summer meal sites throughout the county. So I'm going to drop a link to all of our open summer meal sites in the chat here. The link details the site location, the start date of the program, the end date of the program, as well as breakfast and lunch start and end times. So these are things that are really important if sharing with community members to pay attention to, because not every site runs for the same amount of days throughout the summer. So for example, Albert Einstein High School is starting July 1st and ending August 1st, right? So we wouldn't want to send someone there on August 8th because they're running for the month of July, basically. So we keep this list updated if we have any sites that are added, removed, if sites alter their times, anything like that. Our team makes sure this list is up to date at all times. So we really hopefully promote it as an active live site to be visited on the browser. I know some folks have said, can we print it out and give to people? You can. I would just recommend then we give a caveat that it's routinely updated. So please reference back in case changes are made. Summer is one of those times that programs and things change all the time. And so we just try to keep it as up to date as possible. So anyone 18 and under can visit these sites, eat a meal. Something also to be aware of is that meals must be consumed on site. And so that's a little different than it has been over the past few years, since we had a lot of waivers from the federal government throughout the pandemic that were extended. All of those waivers are now no longer, and we're kind of back to a traditional meal service where summer food service meals are to be eaten on site. So that's something, again, if we're speaking with the community or sharing this information, that would be helpful to share. Please come join us, but be prepared to eat on site. These are not grab and go, which I know we've been able to do in the past. So they're for on site. I'll also drop a link to just a little bit more information on our summer meals program. You can view the menus. There's two different types of site. One that's really more of a bagged meal. That's a quick item. And then some of our schools that have more extensive programming have what we call cafe sites. And so they're more traditionally coming through the cafeteria line, getting a hot meal. So there's two different menus. So if people want to peruse there, I just dropped that in the chat. And we're excited to keep feeding. Today, we had a lot of sites come on board today because of the MCPS summer school programming starts today. So we were serving over the past few weeks. A lot of additional sites lifted up today. It's their first day of operations, lots going on, and we'll be continuing throughout the summer. So that's really my update, and I'm also happy to answer any questions that folks may have on summer meal sites. So I'll just stay on to see if there were any questions. Or Anne-Marie, I don't know how you wanted to facilitate that. Anyway, it's fine with me.
Yeah, no, that would be great. If there are questions, we definitely have some time built in for that. So please feel free to raise your hand or put them in the chat and we can handle them from there. So I'll just give a second before we transition over.
Absolutely. And Katie, I see your comment about not having a site near the ag reserve. And so thank you for raising awareness to that. We are aware of that. So something I don't want to get too into the weeds, but I kind of folks want the summer meals program has some eligibility requirements. And so unfortunately, we have to make sure every site that wants to host meals meets the eligibility requirements before we can put a site there. And we haven't found a site in that area that meets those eligibility requirements. So it is a challenge, and that may be somewhere that we can lean on other community-based partners who can support in that ag reserve that don't necessarily need to meet the eligibility requirements that this federal nutrition program does. So I think that's something as a collective we can do to support the community if we're not able to continue to identify sites within that area. Oh, wonderful. Additional support being offered, but doing this on your own. I see that. Yeah. So I think it's something to keep in mind for this year and future years of how to support little pockets throughout the county. You're right. When I say that there are sites throughout the county, they are, but it doesn't mean every pocket exactly has one. And so I appreciate the elevating that so we can continue to see what we can do there.
So I did get a question which goes along with, I think what Katie is elevating. So there were no sites in Montgomery County that fit the rural requirements, correct?
Nope, correct. So this year, yeah, I believe there might be like a very small pocket in Poolesville that does like technically meet the requirements, but there were no sites that requested any service. Or I don't even know if there are any sites in it, right? Like, and so there are no non-congregate, meaning no non-congregate sites. And in layman's term, what that means are sites that we can distribute grab and go meals at.
Okay. Dana, yes. So in our school-based food assistance group, we will be keeping track of who's still making distributions over the summer. We have a meeting coming up with that group, so we'll be getting that information out and can share that as well. There are some programs that will continue. There are some sites that just don't get the same type of programming over the summer, so the school may not opt to have a pantry distribution during those months, but we are pulling that information together. But thank you for elevating that. Yeah, and I think many of those, if it's capital area food bank, it would be an open distribution. I think some of those may also be closed distributions, so we would need to separate that out, which ones are available to the whole community and which ones would only be for students attending that school site during the normal school year. All right, if there aren't any other questions, I will hand things over to Allison and Elizabeth from our SNAP team to talk about Sunbucks.
Thanks, Anne-Marie. Good afternoon, everybody. So very exciting. Maryland Sunbucks program has now officially launched. It's up and running. This, just to remind everyone, is a new federal nutrition benefit aimed at school-aged children. This is replacing pandemic EBT. So PEBT no longer exists. I'm sure you will get questions about that. This is the program that replaces that. So I'm going to share my screen. I just want to take people through the different websites that allow for wait a second, I'm having trouble showing my screen here. Okay, I got a new computer, so I think some of my settings are a little off. Oh no, it is of course not letting me share my screen.
Do you want, Allison, do you want me to bring it up?
Yeah, do you want to bring up the Sunbucks here? I'll put that in the chat.
Oops.
Fix all my Zoom settings, of course.
Hold on, let me find it. And then
I just threw it in the chat, Elizabeth. Thanks. So this is the Maryland Sunbucks site. It's a really good website. It has a lot of information on it. It really goes through who is eligible, you know, how to determine if your child should be receiving benefits. And, there are, and I kind of just wanted to show it on the screen today because it's a little difficult to navigate because some of the links that you will need are within the Q&A down at the bottom. So if you scroll down, Elizabeth, that's great. So if you click, if you go up a little bit, it's where they have different flyers here. But if you go up further, it kind of goes through all of the eligibility. The thing to really point out here is that most students are going to be automatically enrolled in this. It's really those students that are at schools that recently became part of the community eligibility provision who may need to apply. They may not need to apply, but they may need to apply. The way that they would do it is they could go, and now if you scroll down, Elizabeth, what's a little hard to find as you go into the FAQs, it says, how do I apply for Maryland Sunbucks for my child? And that's where you will see a link if you scroll down to the paper application. That's the how do I know. But if you go down to how do I apply,
sorry.
there is a link there. Yeah, right, in that one. Perfect. Apply online. So that'll take you to MD Think. And the good thing is that MD Think, as we know, has been a little problematic for SNAP recipients, but there is a button right now on the homepage of MD Think. You don't even need to log in and create a login for MD Think. You can just click the button. So Elizabeth, actually, if you go to the MD Think homepage, just the actual homepage itself.
I'm signed in. So.
Oh, you're signed in.
Yeah.
Just click on that maryland.gov and see if it takes you to that. Yeah,
Oh.
and go to go to that. And then I just wanted to show people that button right there. If you click out of that, that says apply for Maryland Sunbucks. So if you click on that, it gives you the kind of the eligibility requirements there. There is no citizenship eligibility requirement for Sunbucks. So even if it asks on the application for a social security number, that is not a required field. It is not a requirement of the application. So I just wanted to show people too, if you click back on apply for Maryland Sunbucks, if you go to translation,
call from 5255.
If you go to if you click on that translation button up there on the MD Think website, I'm sorry, it's so much easier if I was sharing my screen. Go back to the MD Think website, Elizabeth. Yeah, and if you click on translation, if you click on these different languages, there are paper applications in different languages. So I just saw this, so that's very helpful too, to know that. So we'll put the links to these two websites. I do think that most of the information that's needed for these programs is available on that, but please feel free to reach out if you run into any problems. This just launched, so we don't know what problems may exist that we just haven't come across yet. We do know that some of our SNAP clients are also getting letters telling them that their child is going to be automatically enrolled in this program. So we can share one of those letters with client information redacted with the group as well, so you can see what some of our residents are receiving. So apologies for the technical difficulties. Any questions?
I love the reminder that technical difficulties happen on our end too, still sometimes. So thank you everyone for bearing with us. Again, feel free, if you have any questions about this now or later on, feel free to share those in the chat. We'll be sure to get back to you. But to keep things moving, I will turn things over to Heather Bruskin to give us some updates from the Office of Food Systems Resilience.
Thanks so much, Anne Marie, and to the Food Council team for having us here today. I think I've had the honor of meeting most of you before, but in case we haven't crossed paths, I'm Heather Bruskin. I'm the director of the county's Office of Food Systems Resilience. It's not a brand new office, but it's still a relatively new agency. And I'm joined by my colleague, Catherine Nardi, who will be sharing some additional details. But to kick things off, I really appreciate the opportunity for a little bit of time with our treasured food security community to share some updates on the final outcomes of the FY25 budget process. I know in the county government, we live and breathe by the cycles of budgets, but this may not be top of your radar. So just want to take a little bit of time to share the information that we have and also answer any questions that you might have to help you prepare and kind of know what's in the pipeline in terms of resources from the county government related to food this year. And so the county's budget cycle is from July 1st to June 30th timeline. So we just shifted from FY24 and into FY25. I had joined this call a little while ago, I think a couple months ago, to share what the county executive had recommended in his FY25 budget that was sent over to council in mid-March. And so in May, council made their final decisions about what of the recommended budget was included and what ultimately was not. And so the good news is there are a lot of resources for food security in the FY25 budget. You may remember that in December of last year, there was a special appropriation that infused an additional $11 million into our food security work, about half of which was for continuation of staples programs, and the other half of which was to launch new initiatives in support of the recommendations of the strategy to end childhood hunger. And so our office has been incredibly hard at work getting all of those different programs off the ground since that special appropriation. But there had remained a big question of how much of those new initiatives in FY24 would be annualized and continued in the FY25 budget. And so again, the good news is all of those new specialized grant programs are renewed for FY25. And so those had been kind of partial year funding because the special appropriation was mid-year through a fiscal year. So for those specialized grant programs, we just made awards for the resident and community gardening grant programs for FY24 just last month. So stay tuned for a press release, but a lot of really exciting projects supported by the county in those funds. And so that program will take a pause to reset the cycle in FY25. And then we hope we'll have funds in the FY26 budget to launch another round of those. But we've already launched the FY25 school-based food assistance grant program. I think you've probably seen information on that from Anne Marie, and Catherine's going to share some updates and details on that in just a second. But later in the year, we will have additional renewed funds for supporting food as medicine partnerships. And so those are grants that support relationships between primary care service providers to children in underserved communities, and partnering those screenings for food insecurity in pediatric populations with referrals to nutritious food assistance and education support from community-based providers. And then we also will have a renewal of the SNAP outreach and enrollment grant partnerships. And so those were awarded just this past April as well with the food as medicine. So Catherine will share some updates on the specific timelines. But we hope and anticipate that we will not be doing them all at the same time like we did this year, and rather really hope that we can stagger the launches both to be better aligned with the programmatic cycles as well as to kind of make things more manageable on an annual basis, both for us as well as for our partners who are applying for these different initiatives. In addition to these kind of specialized grant programs, we also saw a 3% increase for cost of living adjustment for our contracts. So organizations that have funds in the base budget in partnership with the county will get a 3% increase. You should have heard about this already from your contract monitor, but if you haven't, news will be coming soon. And there were about 20 contracts that did move from the Department of Health and Human Services under the Office of Food Systems Resilience umbrella. And along with those contracts, we are joined as a team by Deanna Tato Nikdash, who brings incredible expertise and dedication to our food security work, and has officially transferred over to our team from HHS. And we couldn't be more excited to have her working alongside us in this effort. So the biggest transition comes in terms of the staples programs, which really are kind of baseline core food assistance funding that emerged that was developed during the pandemic. And so there's two programs that support over 70 partners in total. One is with the Capital Area Food Bank and one is with Manna Food Center. And we continue to be exceptionally grateful for those two organizations' partnership in administering these resources for our community-based organizational partners. So how the way those programs were run was primarily funded through ARPA dollars, and in general wasn't as inclusive, transparent, or data-driven and strategy-driven as we really need them to be now that these programs or these efforts are funded through local dollars. And so as if you are a Staples partner, you should have already heard about continued funding through the initial months of FY25. And so our hope is that creates a runway for those organizations that have historically been funded to continue operations through at least October of this year, hopefully with some additional supports in a variety of programs. We'll be able to hopefully last maybe even a little longer than that. But that gives us time to launch our new Community Food Assistance Grant Program. And so this is a brand new initiative, and this is really what the Staples-like funding, so core support for food assistance provider organizations, providing resources for food assistance to county residents. That's what this program will look like in the future. We had originally, the county executive had recommended $7 million in his FY25 budget for this program. That was based on kind of prorated cost of maintenance effort for this program for next year. And unfortunately, only half of that was included in the budget for FY25 when council passed the final budget. But we are still hopeful that these resources can be stretched as far as possible. And where this is the first time that we're running this grant program, we'll be able to collect critical data on what the recommended funding amount was, which we hope will inform future decisions in county budgeting processes. So that program we anticipate will launch this summer with awards made in sort of the September-October timeframe. If you've ever gotten a grant from the county, you know, even if the Office of Grants Management is incredible and as they very much are, it still takes some time to go through the administrative processes. So our hopes are that payments will be out the door in October or early November of this year. So those will be open for all organizations that currently provide food assistance to Montgomery County residents. And we don't have details about that because it's still very much in progress, but we'll be continuing to share updates over the summer. And just want to clarify, the biggest shift is that our hubs or service consolidation hubs will have a separate source of support for funding that's administered through DHHS, because those contracts stay with HHS and they have a separate source of funding for that Staples program. And the community food assistance is under the OFSR umbrella and is a separate resource, although all organizations are open to apply to the strategic grant programs like school-based food assistance, food as medicine, and all of those. The only other two things I think that I want to make sure we highlight are that in addition to grant-based programs, the MC Groceries program was also created. That's a retail food assistance program that OFSR has been launching in close partnership with the Department of Health and Human Services. And so we are finalizing the details on that, but we hope that these benefits will be accessed by residents as soon as in 2 to 3 weeks. And this provides $100 per child per month for up to a year, up to $400 per month. And that's for grocery shopping in partnership with Instacart. So that means that they can choose from a wide range of retailers, have the products home delivered, hopefully getting at some of the time and transportation barriers that a lot of our residents experience. And these are for residents with incomes 400% of the federal poverty level or below who don't qualify for SNAP. And so our hope is to sort of support a lot of the families that live in that self-sufficiency gap and also are not able to access federal assistance. And so we'll share more news on that program as the program evolves. But just wanted to kind of let you know that you may be hearing about that program. And if you get any questions, please refer them to the DHHS navigation line because they are managing resident support. So the other piece is that SNAP support expansion, unfortunately, was not funded in the FY25 budget as recommended by the county executive. And so the childhood hunger plan had launched a expansion of partnerships of SNAP outreach at all the MCPS schools with the navigation team. And unfortunately, those positions, those contract positions won't be continued into FY25. So we're looking at finding ways to continue to support SNAP enrollment for our families with children through partnerships with MCPS and other ways, and also had hoped to expand the CBO lead organization, SNAP outreach work, to pull other organizations under existing umbrellas for getting state and federal support. And unfortunately, that expansion was not funded as well. So if you hear questions about, what wasn't funded, just want to make sure that you have all the information that we have. So Catherine, I think Anne-Marie, I think we've got a minute or two if Catherine wants to answer any questions and share a little bit more information.
Of course, yeah. And I will say just quick before we change topics, there was a question in the chat about for the resident food purchasing, if the delivery fees will be waived under that program.
So I would love to talk at another time about all the ins and outs of the program, just as we're kind of finalizing all these pieces. But in general, it works like shopping credits at Instacart, so to cover whatever expenses are. But the program is not structured with fee waivers specifically, but they can be covered by benefits, if that makes sense.
All right. Thanks, Catherine.
Thanks so much. I was just going to chime in briefly to share a couple quick updates related to our grant programs. As Heather mentioned, our FY25 school-based food assistance grant program is now live on the Office of Grants Management platform. We will be accepting applications through Friday, July 26th. And there will be an info session for interested applicants tomorrow from 12 to 1 p.m. All that information is available on the OGM website. We are also starting to plan for our other FY25 grant programs, although it seems like the FY24 processes just wrapped up. We'll be starting to expect mid-cycle reports from our current food as medicine grantees in early August. And then the performance period for that grant program goes through the end of November. So we'll be starting to plan for a launch of the FY25 Food as Medicine grant program in early 2025, likely in January of 2025. Similarly, our SNAP outreach grant program, which has a little bit of a longer performance period, will go through March of 2025, and then we'll be launching the application process for the next round of those grants. I also wanted to highlight that there's an opportunity currently available to farm partners. I don't know how many farm partners are on the call right now, but for farms that your organization may be working with, it's worthwhile for you to know about and share the information with those partners. There's a collaborative funding agreement opportunity between the OFSR and Manna Food Center that will allocate funds to successful applicants for pursuing projects of their choice within certain eligibility criteria. And then the applicants will essentially repay 80% of the value of the funding amount they receive through the Farm to Food Bank program. I don't know that that was the least complicated way of presenting the information, but our website and Manna's website has more information on the collaborative funding agreement opportunity. So if you are working with any farmers, I'd encourage you to share the information with them so that we can continue to invest in our local food production sector. I can put the link in the chat box to the webinar tomorrow for those interested in the school-based food assistance grant program. Again, that information is also available on the Office of Grants Management platform. I'll pause there in case there are any other questions, but Heather mentioned that the gardening grant agreements for FY25 gardening grantees just went out a couple weeks ago. So we're looking forward to working with those partners, and we'll be continuing to share press releases and posts on our website and newsletters and social media posts, etc., to highlight the successes of all of our different grant programs.
Thank you so much. I did get one question about the MC Groceries program, that they are hearing from families who are curious as to when they're going to be contacted with further instructions. Is there anything that you can share there now or in terms of timeline?
Yes, so everyone should have received a follow-up instruction, and but as you might imagine, there's a lot of moving parts to things like this. So if they have received instructions on the sort of final enrollment form to complete, then they should be hearing back in a week or two, and with the codes and instructions on enrollment. But if they have any questions about the status, making sure that it was received, they should contact the navigation line.
Okay, thanks so much. And thank you for a transition over into our main topic of the day, which is food as medicine programs that are currently operating in Montgomery County. Heather and Catherine mentioned the OFSR grants for that, tied in with the strategic plan to end childhood hunger. And the groups that we're going to be, or some of the groups that we're going to be hearing from today, are participating in that grant, but they are also organizations that have really kind of been at the forefront of operating food as medicine programs in the county for some time now. So we are really thrilled to have 3 presenters joining us today with a background, some of whom have a shared background in kind of all of these spaces. And I'm happy to turn things over now to Anthea Levy of CHEER to start sharing about their work in the food as medicine space. So welcome, Anthea, and thanks for joining us today. Oh, sorry, you're still on mute.
Hi, everybody. Glad to be here. Thank you. Yeah, I've been working for CHEER for the last 6 years, and CHEER was founded about 10 years ago. For those who don't know CHEER, it's a very small nonprofit working in Silver Spring, and we have been awarded a grant to work with 5. There were 5 chosen groups to work as the food as medicine partnerships. One was with the Montgomery Cares for Kids Clinic site, and then 4 others were with the MCPS. And we are doing 2 of those schools, the New Hampshire Estates and the Rolling Terraces. So just briefly, CHEER has had experience doing a diabetes program, which I'll just very briefly go into because it's really what the other programs are based on. with the diabetes program, which we have been doing over the last 7 or 8 years, we would go out into the community, find underserved community members, mostly Latinos, and sign them up for a 12-week kind of class / food receipt program, where they would receive a box of vegetables and fruits from Hungry Harvest, one of our good partners. And we would do, first of all, a quick intake survey with them to establish what their metrics were, and we would work through them on a weekly basis to understand how they were doing with the new fruits and vegetables that were coming into their household, whether their sugar levels measurements were going down, and how they were feeling. And at the end, there would be a closure with a final interview. So we're basically doing the same now with our 3 groups. Cheer is working with the 2 school groups on a 12-week basis. We are interviewing families that have been screened already by clinics that are the school-based clinics for those 2 schools, New Hampshire Estates and Rolling Terraces. And they work through linkages and learning and the YMCA, of course, to find the eligible families. And that's based on food insecurity primarily, but it's also based on BMI numbers that they have access to, and in some cases, a few undernourished children who have come in, whether you can believe it or not, because some immigrant families arrive and their children are kind of undernourished, and it's not easy to get them over that hump. And then there are, of course, food allergies and other conditions. So we take the children who have already been found as eligible, and our role at Cheer is to give them educational classes and to coordinate the delivery of the boxes. So with the school programs, we have about 30 kids right now. They are receiving a Hungry Harvest box of sort of culturally appropriate foods, which I'll go into in a second, and alternate weeks. So it's every 2 weeks they receive a box. Alternate weeks, they are receiving tokens for the farmers market at Crossroads, and they get about $15 worth of tokens. Some of them have SNAP already, so they are kind of doubling that amount of value that they have. I'm so sorry. It's just, okay, good. So then the other program is with Adventist Health, and we have partnered with them in the same way, same 12-week class, same interview based on the county survey that you all have provided, and based on their delivery of boxes to the church. So the families will actually go and pick up the boxes, in their case, at their church. And in that case, it turns out there are multiple kids from some families. So they are saying some families are eligible for 1 box, and then with multiple kids, they're eligible for 2 boxes. We have about 100 families that we're going to be working with, or 100 kids, which breaks down to more like 50 families altogether. And the educational part of all of this is that once we've done this intake survey and established some kind of rapport with the families, then we gain their trust little by little by little. It's a slow process, and they are not very happy at divulging some of the information at the beginning, which is a kind of a give and take, because you need some very basic information in order to even register them. But you have to be a little bit touch and go with the families and hope that the next time you speak to them, you get more personalized information, such as, did you move here in the last so many years, and how was your child born here? and what country is your country of origin, and what languages do you speak in your family. I've had a lot of resistance so far, but we're going slowly and carefully, and they need the boxes so badly that we are accepting them into the program, and we'll be getting some of this information in the second interviews. The way CHEER works it, our community health workers are very, very skilled in working with new immigrants and seeing things from their point of view. For example, somebody told me the other day they just don't know what to do with an eggplant, and it's not interesting. And I said, well, you know, maybe we can give you a recipe. And the response was, no, I don't, my child doesn't even like eggplant. Could you think of giving us, you know, more apples or more lettuce, or et cetera, et cetera. So we're talking to our provider in that case to see if we can get something a little bit more culturally useful for that group. Then the educational part, we've given a couple classes already. We touch base with each family every week to see how they're doing. And this is really intrinsic because they gain even more confidence with us, and we ask all kinds of questions, and many other issues come out of this, which are very helpful for our work at CHEER as a community outreach based group. So yeah, we touch base with them and make notes in our database system on how they're doing and whether it's helping, and how we can improve the effectiveness of what we've done so far. Let's see, we're going to be doing the food demos. The classes will be every other week, but we'll also incorporate food demos where we choose all the ingredients that for example, Latino or an Ethiopian family might use in their cooking. And we kind of try to make it a little healthier, less oil or no fried food, but all the basic flavors or herbs or spices or tastes, we maintain that so that it's still something that's interesting to them. I can tell you that we also are very big on engaging and empowering our people. So if, for example, we were teaching a group of Ethiopian women a few years back a very simple, I think it was a Road to Health class for Ethiopian cooking. We had people come out of that losing, 13 pounds. We had people coming out as model sort of healthy cooking participants. One woman decided she wanted to go into like online cooking classes for other Ethiopian women. So we sort of empowered her to be able to do these classes on her own. And I engaged her and in fact paid her at some point to do a demonstration for us because her cooking was really above and beyond some of the other people at that time. And it was a lot healthier. She had cut down her oils and other ingredients. We've had to explain exactly where the Crossroads a farmer's market is and make sure that people have access to getting there and know what day it is. We have plenty of back and forth with all included groups at Linkages to Learning, the clinics, at Adventists with their lists. We have to stay on top of the coordination back and forth because that can be challenging at some points. Let's see if I left anything out. I think that pretty much tells you most of what we're doing right now. The food is medicine. I mean, it just says what it is, right? We want these kids to feel healthy and engage in fitness programs as well. Part of our educational series will also go into good fitness habits and encouraging the kids to participate in sports.
Anthea, thank you so much. I'll give it a second in case anyone has any questions, either in the chat or by raising their hand, but I have one question myself that I'd like to start us off with. You had mentioned the challenge in getting some information from families, which is not, uncommon to many providers in our community, the challenge of getting data and information that people are leery to give. Do you mind sharing a little bit, are some of these questions, are these specific to, why are you asking these specific questions? Are they required through Adventist? Are they required by other grants that you have? Just trying to get a sense of how necessary some of these questions are, as opposed to things that CHEER just might want to know for its own, evaluation purposes.
Yeah, Adventist has made it very clear that they are only interested in the Montgomery County survey and any questions on that. Now, I'm getting a lot of answers under the ethnic grouping as other. So I know that might not be as useful as you would like, because you'd kind of like a background, how many Latino families, how many Asian, how many Middle Eastern, what African American, African. But that's what I'm getting right now. There may be a point in time when I can change that if they are willing to answer that question again. Admittedly, some of the questions are for CHEER purposes. So I understand where I can leave those out of this so that we can move forward. With the school-based programs, we do need the basic information, like address and zip code and the birth date of the child. It's pretty basic, but we're trying to move forward. I think people will gain confidence, and with 12 weeks ahead of us, we'll be able to fill in the required information.
That's great. Thank you. Any other questions for Anthea? Again, not your last time, not your only time to share them, but if you have them, otherwise we'll move along and we can always come back at the end for a larger discussion. All right. I'm going to turn things over now to Lucía Zegarra, who many of our community know very well, a former Food Council member and someone who has just been involved in this work for a long time now, and also someone who kind of bridges the gap between our speakers, having worked at CHEER herself and serving on the board of Community Farm Share. So Lucía, I'm happy to turn things over to you.
Thank you for having me, Anne-Marie, and thank you for the opportunity to share. So I'm going to share my screen. All right, so I wanted to take everybody to a little journey through time. And this obviously timeline is not exclusive. It's just, what I'm trying to reference today. So in 2017, the Montgomery County Food Council made some recommendations on the Montgomery County Food Security Plan. And under the umbrella of those recommendations, I was part of the Montgomery County Food Council Food Access and Recovery Work Group, called FROG, I remember that. We had a healthcare group that was comprised of healthcare providers and also Food Council members, where we were exploring the screen and intervene approach in Montgomery County Public Schools. So I feel like that kind of starts the beginning of the food is medicine journey in our county. Now moving along towards later in 2017, the Transforming Community Initiative, I'm going to call it collaborative because there was a lot of stakeholders, a lot of organizations involved here. And this is where the Food is Medicine pilot program officially launched. I was proud to call myself the director of community health program for CHEER, so I was leading this Food is Medicine program. And just to give you a quick overview, since I think some of the elements are similar to what Anthea was describing earlier, the goal of the program was to create permanent pathways that basically link safety net clinics with food assistance providers and nutrition assistants in education. Obviously a 3-month intervention that provided free fruits and vegetables, nutrition education, as well as healthy living classes. The data that we collected was clinical A1C, the amount of food received, class attendance, and progress notes from community health workers. Overall, the program led to the BMI reduction, I would say, with an average of weight loss of 8 pounds for all participants. And from participants with diabetes, it was 60% of them that improved the diabetes control. Now, also, I wanted to really touching on the gaps and challenges that we saw. Since we serve a lot of immigrant community members, isolation was one of the biggest challenges, trying to incorporate immigrants in the community so that they can feel supported. Mental health was a big issue as well. And to this day, we see this mental health crisis. So there is a big link between diabetes and depression, and that was very evident for our team. The lack of transportation was another issue that is, and I'm seeing so many synergies in what the programs are evolving to right now. But the best way to confront that challenge was to deliver what folks are already going, which is MCPS sites. Cultural practices were very interesting also, because a lot of individuals didn't know the concept of meal planning, and most women did most of the cooking. So if there's isolation, mental health situation from a male that depends on the woman that's doing the cooking, there's a lot of barriers that a person has to go over. So we had to keep an eye out on program attrition and program participation. And one of the things were creating innovative partnerships to enroll new participants, innovative ways of creating Zumba classes, creating opportunities for individuals to engage in healthy activities, and always forward thinking, seeing what the gaps are, what the challenges are, and what is in our hands to be able to bridge those gaps. Now, overall, the lack of consistent funding from healthcare system is going to be the main obstacle for a sustainable food as medicine program, right? Always trying to identify where the reimbursement can be. I remember the beginning and the inception of this program, the main goal was to recruit individuals from the Adventist Healthcare emergency room, right? So we need to keep an eye on what is the individuals that we're serving, where they are, what is the easiest way to enroll participants. And then the other challenge, and this is something that we saw also through the Screen and Intervene work group for the healthcare group through the Montgomery County Food Council, was that the schools were providing such carb-heavy foods during their meals, and that it was really, really difficult to support students that had diabetes with the foods that the schools were providing. So another opportunity there for to explore on how to support children that already have these diseases. Now, in terms of best practices, and this is something that I'm seeing looking ahead at community farm share, the best practice is to build strong interpersonal relationships, because behavioral changes are motivated by hope and by relationships. So this is really one of the key things. And also addressing social determinants of health. It's a big word, but I'll never forget one of my participants. I went to visit his home, and he was dealing with bedbug infestation. So how was he going to worry about the fresh produce that I brought to his home when he had to move out and get rid of that pest, right? So always going step by step and trying to meet individuals where they are. Another interesting thing that we discovered was that individual change, the personal change, may not necessarily match the duration of a particular program. So flexibility and aligning that is important. Some people may not be ready to change, maybe learning, all the consequences if they don't change. And by the time the program ends, they're ready to change. So allowing some flexibility for that is key. I found it very important to keep a rigorous data collection consistent and reviewing case notes of my community health workers regularly, because that's where that's where the party's at. That's where you see what's going on with each individual. Copious case notes will definitely give you a good overview of what's going on, and some things you can discuss in the group, and some things you have to talk to. I had the lack of having friends that were clinical psychologists, but I feel like a lot of the situations in terms of behaviors, it's really helpful to consult experts in behavior. Now I'm going to move us a little bit along in my timeline over here. We're going to go to 2020, and that's when Community Farm Share was beginning to form. And then I'm going to move on to 2022, when the White House Conference on Hunger, Nutrition, and Health came to be. And I just want to briefly mention too that I was lucky to be looped in one of the convenings to inform the White House Conference. And I remember reviewing policy after policy, and how it mainly, the main scope was individuals that had an immigration status. There was no policy that was supporting immigrants without a status. And being, first of all, being the only Latina in the room, I remember I had to say that there was absolutely no space or no recommendations for refugees or immigrants that didn't have a legal status. Now, moving us along a little bit to the right, came in 2023, we all know our Montgomery County Strategic Plan to end childhood hunger from the Montgomery County Food Council. And later that year, the American Heart Association, wearing my American Association now, put forth a presidential advisory for food is medicine. And kind of like for the first time, giving us an official definition for all those in the field, that basically says that food is medicine may be defined as the provision of health food resources to prevent, manage, and treat specific clinical conditions in coordination with the healthcare sector. We saw that more evidence was needed to demonstrate effectiveness of multiple interventions that have been seen all over the country. And coining the fact that, I don't know, 90% of the 4.3 trillion annual cost of healthcare in the US that was being spent on medical care for chronic diseases. So we know that for many of these diseases, diet is a major risk factor. So even modest improvements in diet could make a significant impact in families. Now, later that year, the American Heart Association put an RFP to conduct research and see evidence for changes in healthy eating behaviors. So we're really excited that that research from this will culminate in large-scale clinical trials to try to accelerate the discovery of models that prove to be clinically beneficial and cost-effective. One of the things that I also wanted to point out on last year is that our local American Heart Association, say the Greater Washington Region team, we put forth a mini grant and awarded 8 mini grants to Montgomery County food pantries for adopting a policy for aligning with the healthy nutrition standards of the American Heart Association. And basically what that means is that instead of turning donations away, they would encourage donors to donate foods that are healthier and can support the healthy outcomes that the American Heart Association is looking to sustain. And then we're gonna go to 2024. American Heart Association and the Rockefeller Foundation award winners were announced, and Community Farm Share was part of a research project. So we were very happy to see the representation of Community Farm Share, actually Care for Your Health also. We're working together with a researcher from Johns Hopkins University. After that, we saw that more food is medicine programming was funded by the Office of Food Systems Resilient Grants, and under the umbrella of the strategic plan to end childhood hunger as well. Now, looking also at our current priorities and opportunities for the American Heart Association, we also, and going back to what as Food Council, we're doing in the healthcare group Screen and Intervene. We're working on similar interventions, and we are supporting and equipping healthcare providers and mostly safety net clinics, and making sure that they're able to screen and refer their patients as efficiently as possible. We have recently been working with a few safety net clinics that are working with a specific electronic medical record system that has the screening on, embedded in their records, but it wasn't on. So these are the things that we're looking at quality and evidence-based opportunities for us to support this kind of interventions, and making sure that patients are linked to food assistance providers. We are also working with community organizations that may not necessarily be food pantries, but perhaps work with individuals. Right now we're working with resettlement agencies to make sure they're also including the food security screener in their intake forms. And we're also working with faith communities to do the same. Now, as I mentioned earlier, last year, we did this food pantry nutrition policy mini grant. I'm looking at doing something like that in the future as well. But if anybody's interested in learning more, please let me know. We're also looking to leverage our sponsors to be able to provide opportunities in Montgomery County and our region to provide fresh produce and to increase fresh produce capacity, providing cold storage, shelving, etc. So all of that depending on funding of our sponsors. And also we are looking at increasing fresh produce sources in general. And if anybody's also interested in that, I will be interested in learning more, so that if there's an opportunity from sponsors, sometimes they reach out to us and ask us for specific locations. Now, one of the things that that I see is that evidence-based research is going to take a long time. Until we have peer review documentation, it's going to take some time. So we need to look at what's available now and what other interventions are working now, and how can we support catapult those interventions and spreading the work that's being done. So on that note, and if there is any other questions, I can pass it back to Anne-Marie.
Lucía, first of all, thank you so much for taking us on an incredible 7-year timeline journey for everything that has been happening in the county. That was really amazing. Obviously, I wasn't with the Food Council at the time, but I was coming to those FROG meetings with you soon after 2017. So I really appreciate, the refresher for me, and, for those of us who are relatively newer to the community, who weren't a part of that FROG working group. That was really just an amazing summary and kind of bringing it all together. So thank you so much for taking the time to pull that together and share that with us. Agar, I saw your hand up, but I don't see you now, so I don't know if you had a question you wanted to share.
No, I don't have any question. I just want to say thank you to Lucía.
Okay. Any questions from anyone else before we move along to Jenny Freeman from Community Farm Share? No? All right. Well, we will still have time to discuss toward the end. So Jenny, please feel free. Thanks for joining us. I know you had a lot going on today, so I'm glad you could make it here to share about your work.
Yeah, good. No, thank you so much for having me, and thank you to Lucía for setting such a great stage of everything that's been going on, and for being our board chair over this time. So thank you for all of that support too. Yeah, so good to be here. I just wanted to kind of give a bit of an overview of what we have been doing in the last I guess couple of years that we've been working in the space of food as medicine. But maybe I'll just kind of paint that framework within the larger framework of what we do. Our overall mission for Community Farm Share is both supporting nutrition insecurity, families addressing healthy food access, and also we also do farm to school program as well, and supporting kids having access to free healthy produce. So our mission, the second part of our mission, that is supporting our local farmers. So all of the produce that we do purchase is paid for. So we do buy produce from our Montgomery County farmers, having that idea that on a couple of levels. One is we want to support our local community, but also with the belief that nutritious produce, it's the nutrient content is even higher and more nutrient dense when it's locally produced through healthy soils, regenerative soils practices, and less time on a truck, and produce is grown to be healthy and tasting as good as it is. So that's our dual mission. Also wanted to just shout out too and start with Lucía did mention like the American Heart Association program that we are so happy to be a part of as one of our funders, but also a big shout out to the Healthcare Initiative Foundation that's been funding us for the last 2 years for food as medicine programs. And again, we have 2 programs with them this year. Both are in collaboration with other community-based organizations. So with Mom Mid-County United Ministries, I think I saw Dana on the call, so she's been a fantastic partner. Hopefully I'll have a chance to jump in at the end too, to do some of the really critical additional community outreach work that is so important as part of the program, as well as WUMCO in the Poolsville area, and Care for Your Health and Proyecta Salud are those partners. We also work with also Holy Cross, and Adventist has also funded our programs as well, supporting both with Mercy Health Clinic is another partner, and CCI Health Clinic as well, and Mobile Med is involved in the program with the American Heart Association. So that's in addition to the county programs too, which are really interesting, and we're super excited to be connected with the Office of Food Systems Resilience work, because those are with 2 high schools. So we're working with Wheaton High School and with Seneca Valley and the School-Based Health Center. So it's really a new, I guess, a new part of the model is connecting food as medicine work with schools and reaching students. So we work in total with about 187 participants this year, which is last year we supported about I think it was 87. So we've increased significantly the number of participants that we work with each week. It's a weekly produce bag that we put together. We do contract purchase with the local farmers so that we're able to source the produce that has been over there. And we get a lot of feedback from participants, like Anthea was mentioning, like, what do you do with eggplants? So we understand those concerns too, and have basically we're really contract purchasing with the produce that has been most requested by our participants, understanding the demographic and meeting their cultural needs, and making adjustments as we go along. So their weekly bags, like I mentioned, we do I guess it's 3 different delivery methods in a sense. One is that we do the bags, so we do home deliveries. We have about 100, I think about 100 participants are receiving home deliveries, but that's including our farm to school program model as well. And we also do bulk drop off. So like at the schools, which is for the school program, kids can take home, or we also do a drop off at the clinics where participants nearby can pick up. Then new this year is we're starting a mobile market, which we actually just got started over at the Holy Cross program, which is another OFSR funded project as well. So for the Office of Food System Resilience project, we started the mobile market where it's a free choice market, and we have bulk produce that we again purchase from our local farmers and have people available. We have our volunteers and staff who also speak Spanish and can have a conversation with people about what the produce is and how to prepare it, and some extra tips in getting to know people. Like Lucía said too, one of the main things that we really strive for is making those connections on a community level and getting to know participants and building that connections to our community. And so we're excited about the mobile markets this year as well. And we do also provide recipes that we've been sourcing over the last couple of years as well, and kind of adjust that each time. And some of the sources of recipes include also from participants as well. So we're kind of including some feedback from the community too. And then on the backs of the recipe cards, we have additional nutrition information. So not just like, hey, this is high in vitamin C or something, but then what is vitamin C for, and kind of bullet pointing a few of the key benefits of those nutrients so that people have a real understanding of that value of the specific produce that we are providing, as well as we're adding storage tips. So how to, if you different ways of some things you should put in the refrigerators, other things you let out, or, put a damp towel over it, or different things like that to make it last longer at people's homes. We do I think it is important that we're having frequent, especially for the food is medicine program, having like a frequent delivery or frequent pickup option, just to make sure that the quantity of the food and the reliability, since it's also a food security issue too, that the same families are getting the same amounts and bags of produce each week, or selection if it's at the mobile market. Our intention is to increase the mobile markets more. We're hoping that increases the bags. I think just having the free choice is a great option. Our system that we would be using to kind of just track everything is really great, because we can actually know like what people are buying, so that way at each location we'd have a sense of maybe certain different vegetables are more desired in certain communities, so we'll be able to track that information over time and make sure that our market then is stocked with more of that produce that is most desired by the communities at those locations. What else? I just want to bounce back to the farmers too. So we work with about 12 farmers, but that's kind of expanding as well. And the way that works is also through another platform, through the local food marketplace, where the farmers can upload what they have available every week. And then through that, we're able to see what there is, and then make those purchases accordingly to, again, meet the needs of the community, both by the items that are offered as well as the quantities. And the value, again, of just working with the local farmers is another health benefit of, like I mentioned before, just not only the nutrient density of the produce, but also eating seasonally is also a huge benefit for people's health as well. Look at my notes, see if I caught everything. Yeah, I think, okay, so that's it. I think one thing I did want to just go through one more time is Lucía also brought attention to really this idea of the healthcare costs that there are because of the unfortunately the poor diets, that the standard American diet, right, the SAD diet, which is high in carbs and processed foods. And so that's huge. Is a big passion project for Community Farm Share. One thing that we are launching now is we're calling it the True Cost of Food campaign. And the idea for that is to both raise awareness and bring attention to these issues, exactly like Lucía said. So there's the health consequence. There's a Rockefeller report that came out a couple of years ago where I think the food system in America, we spend about $3 trillion on food, but 1 trillion of that is actually the cost that is spent then onto the healthcare system to fight the diet-related chronic diseases that have been that are caused by the broken food system that we have, but also the environmental and climate change costs as well. So big industrial agriculture has a huge impact on greenhouse gas emissions and trucking food across the countries or across the world, and losing a lot of the and plus the addition of harmful chemicals on there. So the farms that we're working with are really regenerative farms using cover crops, using sinking carbon in through organic practices. And so that's sort of another part of that mission. So anyway, the True Cost of Food campaign, for anybody who is on the program, is interested on this call and interested, we're actually offering a small match program for that. So understanding the key is that we have that it does cost more. I mean, local produce does have a higher price tag if you're just looking from the bank account perspective. So we understand that, and if a food assistance provider's kind of mission is to feed as many people as possible, which makes complete sense, it's hard to kind of justify sometimes buying that local produce that has a higher dollar price tag. So we're trying to offset that match by offering a matching grant program for that. So people are interested in any local produce purchases going forward. I'll put my information in the chat too, and I'd love to connect with you guys on being part of that matching program. And we're putting together a whole True Cost of Food campaign together as well to help provide more information about the subject matter. So what else? Any questions? I'll pause there, I guess.
Thanks so much, Jenny. I'm checking in the chat to see if there's any questions. I don't see any there. Before we kind of have a little larger conversation though, and give folks a minute to kind of digest all of that and think through any questions, I did just want to share thank everyone for joining us today and for these great presentations. I think it's really timely, to hear from folks that are doing this work in food as medicine, especially in line with the OFSR grants that are supporting that initiative now and in the future. I think some issues came up in the presentations, but I think it would also be helpful for any providers on the call to hear today challenges in this space. So if a provider were considering to want to start a food as medicine program as part of their offerings, the partnerships they're looking for, what things they should be prepared, to experience going into that, and just kind of have thoughts in place and plans in place to make it more successful. So we did talk about, data collection, which we know is difficult across the board, in many areas of food security, not limited to food as medicine. Everyone mentioned, the healthcare provider funding available for such things. The challenges of meeting people where they are, having other situations going on in the home or in life that could make, accessing these programs difficult. And also kind of access for the food. So whether if you're connecting to a farmer's market, can residents, access those markets? Is food able to be delivered? So if you have any other thoughts in those areas about kind of challenges that you've come across, any of the providers here today that you would want to share, or if anyone has, further questions about that, feel free to kick us off, with that. Anthea. I'm sorry, you're muted.
Yes, I would just quickly say to the providers, whenever Hungry Harvest may include some tropical fruits, I'm most unfortunately, they just don't tend to ripen in time, and it doesn't look like a mango looks like in the country of origin. So it's sort of, to be really honest with providers, it's almost better not to include those kinds of specialty items. Just a thought.
Jenny.
I was just going to say one thing is what we have, I guess it's a little bit of a shift over the years that we've been doing this. Essentially, we started being also the key kind of program manager of it all. And so whenever we made the linkages with the clinic and the community-based organization, and then really ran all the operations and the program side of it. And what we started to do, and again, I hope Dana jumps in, but what I love is projects where actually the community-based organization is really, in a sense, taking a lead on a lot of the program work, because I think they're so in touch with the community. They know their population, they understand those needs even more deeply and connectedly, and have more creative ideas to bring in that match those needs. And so I love it that I feel like our role in community farm share now is essentially, I mean, we're still on many programs, still the lead in the, kind of on the operations and program side, but I absolutely love it when we're not. I love it when we're the facilitators of those partnerships to happen directly between the community organization and the farmer. So the way I see it, I didn't pull up a slide, but I have a slide. It's like, it's like the farmer, the community-based organization, and the clinic. And there's just these three circles, and we're not even in that slide. We're kind of like off in the corner is like just the linker, because we know how it works. So we do understand the operations. We have the processes down pretty well. I mean, always improving, but basically we get that. And so what I'd love to do is just have that role of facilitating those links, because the world that I think I really dream in is where the community person, the partner is, it's like, that whole, like, ask your doctor, no, ask your farmer, and I would love for that to actually be reality someday, that those links are directly happening between the farms and the community-based organizations and the clinic. So I think one of the key things too that I really want to raise now, and as long as I keep talking about all this stuff, is getting the clinics, particularly like the Montgomery Cares. I mean, all the clinics we work with are fantastic. I love working with all of our Montgomery County Cares clinics. They're really hardworking, just solidly such good people. I love them, but they need bandwidth, they need support, they need additional, needs to be able to take this on, because it does take on. We do, like Anthea was saying, we take on the clinic side. I mean, well, they do, not me. The clinics obviously do that. And how do we, we're just that partnership piece, but making it more possible and funding the clinics to take this on as well would be my thing. So, all right, thanks.
Lucía.
Yeah, and I also wanted to elevate to see if there's a possibility for the county collaborating in providing grants also along the HHS, because I feel like that's also the natural link working with food and primary care providers in the county as safety net clinics. But then the other thing in also elevating what Jennifer was saying, I feel like there also needs to be consideration for the community organizations that are doing the boots on the ground work. And these grants need to also allocate salaries for community health workers or outreach workers that are also going to allow for consistent training and that are also at the level to adjust for inflation, because a lot of community health workers do not earn a living, with just one job. And a lot of them have to work multiple jobs. And and this is what, sometimes is a little challenging to see, is that we're expecting community health workers to do such rigorous job, such consistent, one-to-one work that not even physicians are able to do. And they're not getting enough, amount of salary. So I feel like, if there's another round of funding and a grant from the county, or if there are other organizations that are here to consider, I know Healthcare National Foundation considers that, that salary, but it's important to be able to identify who are going to be doing the direct work and to make sure that they are accurately compensated.
Anthea. Oh, I'm sorry, you're still muted.
Thank you, Lucía. That was a great comment. Yes, I think it's very true. And CHEER's role is actually to help alleviate from the clinics all that burden that they have already. So we have taken on a huge amount of work in being able to provide just a basic educational role and then the delivery of the food. But they still maintain all the medical records, and they're doing the metrics of the BMI and any other very important health metrics. We're not involved in that part. So.
I also just wanted to quickly jump in for a second, just because I see Casey on the call, and I just wanted to, I didn't pull up my slides, but there's this, probably people are familiar with it, but maybe not. There's this pyramid. It's a food as medicine pyramid thing. And essentially, just to describe it, there's like the top little pyramid, which is medically tailored meals, essentially. And then there's a, yay, thank you, Lucía. There we go. Medically tailored meals are at the top, and medically tailored groceries. And then produce prescription programs is pretty much where we are operating in. And I think this is sort of where CHEER has been. And then there's SNAP and WIC and all of the basic base programs that are supporting nutrition, and then obviously policies and programs. So when I saw Casey, I just wanted to shout out to Food and Friends, because they really focus on this medically tailored meals, this top portion, which is really another critical piece of the puzzle, because that's focusing on particular, participants who really have specific, like higher dietary and health conditions that really require specific produce. We don't do, or meals, I should say. Our organization doesn't do anything cooked or anything prepared, but there's a critical need for that. So I just want to shout that out, that that's really important. And then that middle piece is where we're kind of operating as both on the prevention side and the treatment side. So when we're doing food as medicine programs, although we say we have this 187 program participants that are all referred to us through the 5 healthcare clinics that we work with, I really look at that and say, actually, we do keep data on our household numbers. I could pull it up, but it's probably around 600 to 700 participants in total when we look at the household. And really want to bring that attention to, because it's the preventive side, because there's such a strong correlation between kids and families or anybody that's living in the household, especially if the main meal preparer is diabetic a lot of times, or obese, or any diet related chronic disease. There's a correlation within the family members, so that if we maybe are sort of treating a little bit with the food as medicine programs, the participant who has a higher A1C number or higher BMI, what we're really focusing on in so many ways is the broader household and bringing that nutritious food into the whole household family. So I just wanted to mention those two things.
Well, it is 2:25, and I had a couple of other quick announcements I wanted to be sure to share before we left today. But first of all, thank you again for all of our speakers and presenters, Heather and Catherine, Allison from our team, Anthea, Lucía, and Jennifer, Liz and Nick from MCPS. Just a really informative call today. And look forward to talking with you all more, as kind of this work progresses and, more funds become available in that space. I'm sharing quickly in the chat for those of you who hadn't heard about the Interfaith Work Shelter Fire. There is an article here, as well as a link for donations for that. If you are a food assistance provider that has prepared meals available, because that really is a service that is in need right now, please feel free to reach out through those links to Interfaith Works. On a happier note, I did also want to share, I don't see Christina Berthelot on the call today, but just a mention that that SMATIC has now received permanent funding for their program. Just to note that this isn't new funding or taxpayer dollars. The commission and its funding were born out of the National Master Settlement Agreement, commonly known as the tobacco buyout. And so while they had previously been receiving these funds annually, they were not guaranteed in the budget, and that has now been remedied. So just a congratulations note to them, for everything that they do in Montgomery County to support, matching programs at farmers markets. So I just wanted to acknowledge that in case you don't normally receive their newsletters. And thank you, Catherine, for responding in the chat on kind of the latest that we know about up-county resources for summer meals. I know that that's been an ongoing conversation, so appreciate you kind of bringing Lynn up to, and the rest of us up to speed on kind of the latest on all of that. If anyone else, we have 3 minutes. If there's any other community announcements folks would like to share, happy to make a little space for that here. And I realize I have not shared anything about August. We will keep you posted. I know we do still need to reschedule our tour from last month that was postponed at Shepherd's Table because of an increase in COVID cases. We'll see when we are able to do that in the near future. But like I said, we will keep you posted on plans for August. All right, and other than that, I will let you have a minute or two back of your time in today, but it was great seeing you all and looking forward to seeing you all again soon.
Thank you all.
Thank you.